And welcoming you to Gender Affirming Care, and I'm going to pass it on over to Angelica. Thanks so much, everyone.
All right, good afternoon, everyone. It might be morning wherever you are. I see people from different states, so welcome. Glad you all can make it. My name is Angelica. I use she and her pronouns, and I'm the Education and Evaluation Coordinator at the Ruth Ellis Center. We're located in Highland Park. For folks who don't live here, basically Detroit, Michigan, and have been running different services that are specific to LGBTQ youth for about 20 years now. Yeah, it's gone by quickly, but I've been there for over 4 years, close to 5. Have experience working in our drop-in center with youth experiencing barriers to housing and other resources, and am now mainly focusing on advocacy within different systems of care, and doing trainings, technical assistance, and things like that. Previously have worked in shelters as well, mainly in Chicago and in the western suburbs of Illinois. So I appreciate the work that you all do and all that the folks who work in this field. We definitely appreciate all the work that you all do. We also have permanent supportive housing. I'm not sure if we get into it in this training today. We're going to do a more condensed version. This is usually a little bit longer, so this will be a condensed version, but just for folks who are not as familiar, we do have permanent supportive housing that we're really excited about, that is breaking ground sometime in 2022, got pushed back a little bit due to COVID, but we are very excited to have LGBTQ specific services in terms of permanent supportive housing that we don't see in this part of the country. And so this is something that has been a long time coming, prioritizing LGBTQ youth ages 18 to 24. Folks can stay as long as they want or need to. You know, it's not specific. We can't say that other folks cannot come who don't identify as LGBTQ, but the services that we are providing, we are kind of tailoring those to the needs of this unique population, knowing that they make up to 40% of folks experiencing homelessness on any given day. So that is something we're really excited about. All right, so let's get to the content. The name of this training is Gender Affirming Care. We do talk about more advanced things in this training. So if folks have not taken a more introductory LGBTQ 101 training, maybe going back to some of the recordings that Allison has on file somewhere, that might get folks up to speed if you're less familiar with some of the content we've already done that, for a more introductory LGBTQ 101. So for today, we'll be talking specifically about gender diversity, folks who identify as transgender or non-binary, and less about sexual orientation and assigned sex at birth. We're not covering any of that necessarily. So again, if folks need to, feel free to go back to some of the earlier trainings we've done with Allison and the team. Okay, so we're probably all really familiar with Zoom. Just going over this really quickly. Feel free to start and stop your video, mute and unmute by going to the bottom toolbar there. You can also hover over your tile with your name or your face and do so there. Like Allison said, this chat or the meeting is recorded, so the chat will be as well. So anything that maybe you don't want shared afterwards, I know it's not being shared anywhere, but it is being recorded in some way. So just being aware of that when you are using the chat. We do like to highlight that you can message the facilitators or Allison directly if you have questions that maybe, or comments that you might not want to share in front of the whole group. So it's a little bit more anonymous than messaging the whole group. So feel free to use that function as well in the chat. All right, other things, if you need to raise your hand to talk, feel free to do that, or any of those other emojis. We recommend looking at this when we're doing trainings in the grid view which if you have speaker view or maybe a different variation, you'll see different, maybe just the speaker talking in a corner in the tile. But if you're able to, if folks are on camera, sometimes they're not, but if folks are on camera, sometimes it's helpful to see facial expressions and reactions as well as the PowerPoint on one end. So that is one recommendation. And I'm not sure if we have closed captioning on here. I think it's under subtitles if folks need that for accessibility, but don't quote me.
There's the live transcript is happening right now.
Okay, cool. All right. But again, for any more logistical questions or anything in the chat, Allison will be helping with that. Okay, so before we get started, just to make sure we're all on the same page with how we would like this meeting to feel in terms of safety, we go over agreements before we do any trainings. And so these are a few agreements we'd like to create to make sure that we are all respecting one another and making sure the space is as safe as possible. So we like to recognize that individuals are the experts of their own experience. That might mean different things to different folks, but I can't tell someone about their lived experience and vice versa. So folks, including the people that we serve, are experts of their own experience. We want to disagree with ideas while still respecting individuals, understanding that the impact of what we say is more important to pay attention to than our intention. Sometimes we can hurt people without intending to, but still taking responsibility for the impact or the effect of what we said or did. We want to prioritize safety over comfort, knowing that sometimes unlearning or learning new information can feel uncomfortable. And so highlighting that we don't anticipate that happening, but it can happen when we are talking about more difficult content, as well as unlearning certain things that we've been taught are default or the norm. And so if folks feel uncomfortable at any point, that is okay. But we want to differentiate between safety and discomfort. If folks feel unsafe in any way, psychologically, emotionally, physically, feel free to check in with Allison or myself or step away, do what you need to do. We're going to be watching a video at some point with young folks who've received services, specifically gender-affirming care services at our Health and Wellness Center. And there is, people talk about suicidality to some extent. And so just wanted to let people know that that is going to be something that comes up in conversation in the video, as well as some of the content we're talking about with suicidality and other, more negative health and safety outcomes. So just being aware of that when we're thinking about prioritizing our own safety. Want to use I statements when possible. We're not competing, or the content that we're talking about, we're not competing with other marginalized or minoritized groups. So not having an oppression competition. We want to look at most of this content through a more intersectional lens, realizing that most people that we serve have different identities that are often oppressed in society. And everyone as a teacher and a learner would love to hear as much from you all as possible about how this content relates to the work that you do. And then offering accountability with respect and support. So some of these things we won't need to get to, we won't have to talk about these. Most of it is me talking throughout the day, but when you're in those breakout groups, you just want to remember these agreements and be respectful and when we're in those breakout groups of people. Any questions before we get to the actual content? All right, and Allison, feel free to interrupt me at any point if there's something in the chat that I don't see. So if you're not as familiar with the Ruth Ellis Center, our vision is to create opportunities with LGBTQ+ young people to build their vision for a positive future. So we do this in a variety of ways. One of our main services is a drop-in center where young people come to have community, be around folks who have similar and shared identity. It is a youth-driven space. It is predominantly peer-led space. Most of the folks who work in the drop-in center previously received services at Ruth Ellis Center and have a lot of lived experience similar to the folks that we're serving. And so that is a huge resource for folks. We have a clothing closet, laundry facility, emergency case management, hygiene kits, showers, food pantry. I'm sure I'm missing things, but it's a one-stop shop for a lot of folks. And so that is often where people will first come into the center, learn about the center through word of mouth, and then be connected to different resources like our Integrated Health and Wellness Center or housing. And so people will often come into the drop-in center first and then learn about our other services after that. So our Integrated Health and Wellness Center, we'll be mentioning that today as well. And you'll hear from some of the folks who work in that center who are doing primary care, who are doing HIV prevention and care, gender-affirming hormones, as well as behavioral health staff who work with folks. So we'll hear from them in the video. And then also, of course, we've got our housing program. So they do a lot of great work helping people connect to resources and affirming landlords, and now our permanent supportive housing. So they work closely with a lot of you all here. I know Luke and Joya, you all might be familiar with those folks. Okay, so we're just doing a brief review with language. I'll be saying LGBTQ plus. I know we all probably have different understandings of that acronym. It gets a lot longer, you know, so I'm not going to go into a longer acronym. I'll say LGBTQ plus, as well as diverse SOGI. So SOGI, if folks are not as familiar with this acronym, is something that's being used more and more, specifically when we're talking about different systems of care and intake forms and demographic information. So everybody has a SOGI. And so when we're thinking about collecting data and information, making sure that we are most appropriately serving folks, this is demographic information that we haven't historically always asked folks, but can be really helpful when determining what appropriate services people need, when thinking about safe referrals, permanency and placement stability. So sexual orientation is something that intake forms, we're seeing more and more on those forms, and we do consider this a part of demographic information. And so this is just who we like, love, want to spend time with, who we are attracted to. So the SO of SOGI stands for sexual orientation. Whether someone is heterosexual, gay, lesbian, queer, however they identify, this category is a more comprehensive way of talking about all of those identities without having to name them all. So that is often why we use this acronym. Similarly, gender identity, we all use different words to name our gender, whether we are cisgender, transgender, identify as men, women, non-binary, all of those different identities we're kind of covering with this comprehensive overarching category of gender identity. So that is the GI of SOGI. And then finally, the E is expression. And we don't talk a lot in the LGBTQ plus acronym about identities that are related to gender expression. And so whether someone is masculine or feminine, androgynous in the way that they dress, the gender roles that they perform in society. So that is what we're talking about when we say gender expression. And often the first thing we see when we meet someone or when we hear their voice, that is about their gender expression, the way that they are holding their hands, carrying themselves, et cetera. So we'll talk a little bit about that today when we're talking about gender affirming care. But also when we think about young people who might not have the language to name their gender identity yet, young people around age 3 have an awareness of their gender identity that early, and their gender expression might be visible to us, and it might not align with what we expected it to be based on their assigned sex at birth, or it might. But gender expression is something that we see with young people, even though they might not have the language to say, hey, mom, I'm transgender, or I'm non-binary. We can still see some of that showing up in their gender expression. And so we think that's important to highlight when thinking about folks who have diverse SOGI. You know, it's not just about gender identity, but also expression that can tell us a lot about a person. And their safety is often impacted by how they show up in terms of their gender expression, how feminine, masculine, neither or both they are at any given moment. Okay, that was a lot of information, but do folks have any questions before we move on to?
I don't see any in the chat.
Okay. Cool.
And I don't see any raised hands.
Okay. So in our longer training, we talk a little bit more in depth about gender and what it is again. But I think the main takeaway is that our gender identity is different from our assigned sex at birth. And historically, we have not thought about it in that way. If someone was assigned female, I'll use myself as an example. I was assigned female at birth. That is on my birth certificate. When I was younger, I didn't think about it much because, you know, what people told me I should be, a girl, I always identified that way. And so I'm a cisgender woman. I was assigned female, always knew myself to be a girl, identify as a woman now. Sometimes I had more masculine gender expression, but I always knew I was a girl, and I knew that pretty early on. And so for all of us around age 3, whether we are cisgender, transgender, or something else, we have that awareness pretty early on. Whether or not young people who identify as trans feel safe enough telling people that or repeating it once they've been told that you're too young to know that, or no, you're just going to wear this outfit, not the one you want to wear. Oftentimes young people will suppress that, not talk about it after they've been told they can't anymore, but they show us pretty early on. And so we work with young people as early as age 5 in our family preservation program, in the program with our behavioral health team who work closely with families of LGBTQ youth. And we see young people who have diverse gender identity and expression really early on, as early as age 5 for our programming. So that is the main takeaway here, that gender is different from assigned sex at birth. And for a lot of our society, our assigned sex at birth matches our gender identity, but that is not the case for everybody. So we're going to be focusing on folks today whose gender identity is different than what society might expect it to be based on their assigned sex at birth. So you'll see folks in the video we're going to watch talking more about this and their experiences. Okay, so before we get into the video, this is just a little bit of the why. Why are we talking so much about trans identity? This is a report from respondents in the US Transgender Survey. And 81.7% of those folks reported seriously thinking about suicide in their lifetimes. So just wanted to let that sink in for folks. That is 81% of folks who have thought about suicide in their lifetimes, identifying as trans in this survey. So this survey is the largest of transgender folks in the US to date. And it is an older survey, but this is I think the newest one that we have. And of that 81% of folks, about 48% of those folks had thought about it in the past year. So while it says over their lifetimes, half of that number, a little over half, had thought about suicide in the past year. And so when we're thinking about the clients that we work with, the folks that we serve, our colleagues, our peers, anyone we're coming into contact with, they are experiencing a lot of minority stress that many people who are in minoritized groups experience due to a lack of acceptance and affirming behaviors within different groups in society. They deal with a lot of stigma, but this group also deals with a lot of rejecting behaviors early on in their early experiences with caregivers, which can be an entirely different component of feeling rejection externally in different spaces in society. A lot of folks who identify as LGBTQ and trans folks specifically experience that same stigma in the home with their caregivers. And so that leads to another layer of harm and a lack of protection that folks often experience, and a lack of safety. Okay, so this stat is saying over half, about 54% of transgender individuals reported experiencing intimate partner violence. And so when we're thinking about shelters that are specifically for folks who are experiencing intimate partner violence and who might need to be in those shelters, who might need to seek safety in those areas, we might not think about trans folks as needing those same services at the same rate. Maybe folks are thinking that those are women's shelters and only cisgender women need those services or should be provided those. But we know with the equal access rule that those shelters are if due to HUD's policy, they are obligated to take folks who identify as women. So if it's a women's shelter dealing with intimate partner violence, anyone who identifies as a woman can go to that shelter. If there's a shelter specific to men experiencing intimate partner violence, anyone identifying as a man should be able to go to that shelter. And so again, if you didn't see that last training where we talk more about the equal access rule, there are some recordings, I believe, if you have more questions. So I'm just going to read a little bit more from this study. So we're looking at that, the 54% of individuals reporting experiencing that. And then it says, including over 35% who experienced physical violence. Almost 1 in 4 reported severe physical violence by an intimate partner. So that's 1 in 4 folks. And this is from that same survey we looked at in the last slide. Almost half, 47% of all transgender individuals reported being sexually assaulted at some point in their lives, and 1 in 10 reported sexual assault in the past year. Higher rates were reported by those who had been homeless, about 65% of those folks, and those who were disabled, so 61% of folks. So higher rates for folks who experience homelessness, as well as folks who reported having disabilities. So just wanted to keep that at the forefront of our mind when we're thinking about the why. Why are we discussing this and why is this so important? Because we know these folks are having really greatly disproportionate experiences to other folks who are not transgender. So we're not even talking about the whole LGBTQ acronym. We're talking about trans folks specifically, and the fact that they have higher rates of suicidality, experience less safety in relationships with intimate partners, as well as when they are in shelters, they are also experiencing less safety in those spaces. And so there's often a misunderstanding or some miseducation around who is experiencing more harm in these spaces, who is more of a predator, and typically folks who are transgender experience more harm, more discrimination in spaces like this, in shelters. So there is another study, I can't see it, I'm sorry, but there's another statistic that I would love to share. I'll put it in the chat when I'm able to see it, that talks more about experiences that folks have had in shelters and experiencing discrimination and violence from folks in the shelter, as well as from staff in shelters.
We have a question in the chat asking if that guidance only applies to shelters that have HUD funding. So yes. I will, yep. And we will be posting the equal access training in the chat, which goes over that more.
Yep, so the equal gender access rule only applies to folks and entities that are receiving HUD funding. Good question. Okay, are there any other questions before we get into this video? It's a little bit longer, it's about 25 to 30 minutes, but we do this model in this way because we know that having folks with lived experience communicate with you all is more effective than me or anyone doing research who is not in the community or who does not have lived experience. And we also know that talking about this over and over again can be a traumatizing experience for folks. And so by recording it, we're allowing folks to share their story one time without having to constantly relive it, but also providing you all with really important information that you might not hear otherwise if it's not coming directly from these folks. So it is a little bit longer. Again, there are some mentions of suicidality. So please, whatever you need to do to take care of yourselves, do that as well. But I think there's a lot about resilience and a lot of the strength that comes along with being a transgender person, having to navigate safety in a way that is different from other folks. So feel free to put anything in the chat that you need to. We're going to come together after the video and discuss some questions. But for now, just kind of sit back and relax. Feel free to turn your cameras off if you'd like, because it is a longer video. And Allison, let me know if the AV is okay or if at any point it gets choppy.
Sure.
Thanks.
Without being able to transition, I probably wouldn't be here. Just where my mind was and my mentality about life. Like I said, I was an empty shell of a person, so I really didn't feel like I was gonna be somebody or I could have my dreams met. Without being able to transition, I wouldn't be here. I wouldn't be here.
My name is Maureen Connolly. I use she, her pronouns. I'm a pediatrician in Detroit, Michigan. I specialize in caring for adolescents and young adults with a specific focus on caring for lesbian, gay, bisexual, transgender, queer, and questioning young people.
My name is Rogelio Castro. I use he and they pronouns. I am an outpatient therapist here at the Ruth Ellis Health and Wellness Center. I am a self-identified queer Latinx immigrant from Mexico.
I'm Dr. AMORIE Robinson. I'm also known as Kofi Doma. My pronouns are she, her, and hers. I'm a lead behavioral therapist at the Ruth Ellis Health and Wellness Center. I'm also a clinical psychologist, fully licensed. Been doing psychotherapy for 25 years. I identify myself as a Black, masculine identified, cisgender lesbian, baby boomer.
My name is Charlize Jackson. I go by she, her pronouns. I also am a healthcare worker here for the Ruth Ellis Center. As a healthcare professional as well as a transgender patient, gender health services definitely help alleviate people who have gender dysphoria like myself. Everyone comes from different backgrounds. Everyone has different races, different genders. It's just, we understand that you have your beliefs and views, but at the same time, we all deserve happiness. We deserve to have a regular life, a life with kids. I know people who are trans and who are politicians, who are doctors. It's just a simple fact that we deserve and we demand respect.
My name is Ramonte Parker. I am the Executive Director of New Way Brotherhood in Detroit, Michigan. We've been helping out the trans man community for at least about 4 years now. Made me free for myself, getting all the help I need as a man. Me seeing Dr. Mo is like, hey, you know, it's just the love, the good energy, not because of how we look. Don't discriminate that, just love.
I would describe gender as a cultural expectation. People have an assigned sex at birth, and I'll even say that within that concept in healthcare, even assigned sex at birth has a lot of wonderful diversity within it. There are intersex conditions and differences in sexual development. So even this concept of you're male or you're female is actually much more complicated within the field of healthcare and medicine.
All right. Well, I would think that I find myself oftentimes defining gender a lot because of reactions to my gender expression. The way that I would address someone who you know, would like to know more about what gender is, I really let them know that it's not as simplified, I guess, as we've been taught, and that it's more complex and multi-layered, and that we have been socialized to put gender into a box, usually 2 boxes, as we've taught that gender is binary, but instead the gender is an identity. It's something internal and personal to us. It's our personal sense of self. And for some people, they might identify with multitude of different spectrums along human variation that we have and that we realize that we do have and can appreciate. And actually, gender identity usually form between the ages of 3 and 5. But we've got to be careful as providers, though, to not, you know, place people in particular boxes and find out how they identify. And it's detrimental to force people to conform to a particular gender that doesn't fit them. That's where we often get into trouble in our work. In fact, the American Psychological Association just came out with a resolution against gender identity change efforts because of how detrimental and damaging that can be. And so expanding those boxes and seeing gender more as variant and expansive will really help us in our work.
Transitioning is an umbrella term to describe the process that someone goes through to bring their external self more closely into alignment with their gender identity.
In gender-affirming care, we sit down with the client and ask them what their goals are, because this is a client-centered type of process.
For some people, that might mean changing their gender expression and the clothes that they wear or how they wear their hair. It might mean using a new name and different pronouns, and that's wonderful. For others, it can involve taking medication to make their body more closely aligned with how they identify in terms of gender. Typically, that's masculinizing or feminizing medications or hormone therapy. People can also choose to pursue gender-affirming surgeries, which are surgical interventions to bring their body more closely in alignment with their gender identity.
We do a lot of psychoeducation with clients. We help them to navigate for themselves, the system, and even other systems of care as well. And so we do a lot of advocacy, and we help clients to advocate for themselves.
So transition is going to look different for everyone. There's no right way to transition, but in healthcare, we have amazing tools to support people in that process so they can move through the world as their most authentic self and be healthier and happier in living their truth. When people are in their preteen or adolescent years, obviously we all know puberty happens. It's not fun for anyone, but it can be especially distressing for people whose gender identity doesn't align with the sex they were assigned at birth. What this can mean is that they are essentially going through the wrong puberty. Changes are happening in the body that can be irreversible and can make it harder for someone to live in their true identity for the rest of their lives. Having access to gender-affirming medications for people under the age of 18 or for minors can mean that we can actually prevent those changes from happening through the use of puberty-suppressing medications, an example being Lupron or GnRH agonists. These medications effectively put a pause button on puberty. They are completely reversible, and they have been used for a long time for conditions like precocious puberty. They put a pause button on puberty and give that young person a chance to breathe without these ongoing changes that can, again, lead to an immense amount of distress and make it harder for them to live as their affirmed identity as an adult. The young person gets a chance to breathe. That also gives us an opportunity to connect with and support the adults in that young person's life, to help them on their journey to understanding, to answer the questions that they may have, the concern, the love they have for their child, really affirming that and showing them how supporting this process will lead to overall well-being for their child or the young person in their life. If that young person's identity, persists and is consistent in terms of, yes, this is who I am, I want to proceed with gender-affirming medications, we can start feminizing or masculinizing hormone therapy in adolescence. And this then allows that young person to develop, in medicine we call the secondary sex characteristics of their affirmed identity. The medications that we use for gender affirmation are medications that have been used in healthcare for a very long time. These are medications like testosterone, estradiol, spironolactone, puberty-blocking medications like Lupron. So we have really good safety data for the medications that we use for gender affirmation. This is a newer indication for using those medications. It is true that our data regarding using these medications to affirm someone's gender is newer and in development. But the medications themselves are very well studied, which is reassuring. And we in healthcare are now just recognizing how medically necessary they really are and putting resources and effort into studying them and coming up with really important answers to how to do this care as well as possible.
My name is Righteous first and foremost, and I go by they, them, their pronouns. I think I might have been about 8 years old when I remembered or that I recall having any thought of being transgender or gender nonconforming. Usually when I came out, people would be so almost spellbound. They wouldn't say anything. They wouldn't know what to say. I'm very used to not getting an answer or any response, and it hurts because it feels like they don't want to investigate. Most of my dysphoria comes from people misgendering me. With gender-affirming care, I could get the hormones I needed for free. Now I just feel more comfortable that healthcare is always there for me, and those people are always there for me, and I'll know my doctors and my counselors. One of the strongest reactions I got was just, from my parents, and they just told me I was going to hell. I mean, I thought I was going to hell. That's a very scary idea, right? Like hell, fire, and brimstone, and a devil constantly torturing you, right? So systematically, I think there's this disposition where you're a deviant, you're a social deviant, and then at that time, I was a religious deviant. So it felt like I was an outsider to this whole world of America. On top of not being, a European American, I was Black. So I was deeply outside of all the points that give you privilege. So I've been a marginalized person for a long time, and I'm coming to a point of acceptance and embrace now.
Thinking about and being mindful of your own privileges and biases, that's really, really important. And that's that cultural humility that I was talking about. Being okay with discomfort and realizing that your client is the best expert on their own identity, their own experiences, their own body.
It's really easy to be able to introduce yourself to somebody, say like, hi, my name is so-and-so and these are my pronouns. And it allows for people to feel safe of being like, hey, this person is asking me how I want to refer to myself. So you can simply do that.
There are plenty of resources out there, including the Ruth Ellis Center, of course.
I understand that for the adults in a young person's life, it may seem like a huge decision to start medications to affirm their gender identity. Parents ask me all the time, how can they know? How can they be certain? And I ask them in return, when did you know you were a boy or a girl or whatever their gender identity is? I'll speak for myself as a cisgender woman, that is, I was assigned female at birth and I identify as a woman. I knew I was a girl when I was 3. I was certain of it. And if someone asked me in childhood or adolescence, how do you know? I would just say, I know. So that level of belief and trust in young people's experience, in what they're telling us, is important when we're working with transgender and non-binary young people as well. We know who we are. Young people know who they are. And so all of this is in recognition of that truth, and also recognizing that if we support young people in who they are going to do well. They are going to thrive. Now, starting gender-affirming medications does not solve every challenge that a young person might be facing. Life is complex, especially being a teenager, but I hope we can all recognize that feeling like we are being affirmed in this most basic part of who we are will enable us to then face the other challenges that may be coming up in teenage years and young adult years. So again, I think it's incredibly important. I think it's medically necessary, and it is very hard for a young person to thrive and do well and get through those tough teenage years feeling like they can't be who they really are.
Oftentimes, when a person doesn't have the access to providers who could provide assistance and guidance, many people may use their own ways of getting what they need. And that can be very risky and even dangerous and harmful. Mental health outcomes that are negative, anxiety, depression, stress, and oftentimes thoughts about dying by suicide, self-harm, overuse of substances, lots of self-destructive kinds of behaviors. And so we've got to be really cognizant about being accessible and having cultural responsiveness in our agencies. For many of these clients, these procedures are medically necessary. And if you yourself are not non-binary, gender non-conforming, or transgender, you might not be aware of that. Oftentimes when we have the privilege of not being transgender, we have no idea what the stress level is for someone when it comes to their core identity, their gender.
From a very early age, I always knew that I wasn't a boy. Younger, it definitely got to me a little bit because it was more so people seeing me less than as human. Feels like a weight on your chest and your shoulders, and living every day and you can't be who you are. It does take a mental toll. Made me very dysphoric, and what I would used to do is put covers underneath all my mirrors because I didn't like the way that my body was presenting when I was seeing something else. So my father was very conservative, and so he didn't like the fact that I wanted to play with Barbies and Bratz dolls and not play football. So he used to do this thing where I would have to pray the gay away, and I was not gonna do that. I first started off as a patient here at the Ruth Ellis Center, and so that process was a little bit overwhelming because I kind of sort of had to go through it on my own. But me being a patient there for years, and it was like, okay, well, I feel comfortable enough to where what can I do to help support my community? And if they're new patients, especially patients who receive gender-affirming care, I can tell them what that process looks like because I went through it. Actually talking to somebody about it and them actually understanding and want to help you and support you in the way possible, it makes you affirmed, and it's like, oh my God, I don't have to do all these things. But me actually seeing the changes that I wanted to see, as well as wear the clothes that I want to wear and act how I want to act and be who I want to be, it's just very affirming. And thinking about it now, some days I'd be like, oh my God, I came from a lot. I get to walk in places and not feel, you know, like, oh my God, I'm stuck in this husk and I can't be myself, and that's not the case now.
The process of accessing gender-affirming services for someone under the age of 18 can look different for each individual. But in general, it starts with a young person sharing their identity with an adult in their life. That can be a family member, a teacher, a close friend. It can also be a healthcare provider. In healthcare, we have an amazing opportunity to be the person that a young person shares their identity with. And what an amazing opportunity to offer support, to offer encouragement and gratitude for that young person sharing that piece of who they are. Even if we're not familiar with the healthcare interventions for affirming someone's transgender identity, we have an opportunity to support them and to let them know that we're going to learn more. For someone under the age of 18 who has shared their identity with their family, we're also going to involve family in the conversation. Transition or affirming someone's gender identity is a process. It evolves over time. And so having a network of supportive people around that young person is always going to make the process go better. From my perspective as a pediatrician, I worry more when a young person feels like they can't be themselves. That is when I see the outcomes of increased depression, anxiety, higher risk of suicide, substance use. When a young person feels like they can live their truth, has the support of people around them, they can thrive. And I can say, as someone who cares for a large group of transgender and gender nonconforming young people, I see them thrive every day. For someone under the age of 18, the process of starting medical transition typically requires the consent of a guardian. And also, at this point, we ask that young person work with a supportive therapist as well. Oftentimes, the conversation is more complex with family than with the young person. So part of asking that young person to work with a supportive therapist is to help them navigate some of those complexities as well. For a person under the age of 18 who will be starting medical intervention or medications for gender affirmation, we require consent of a guardian and also a letter of support from a therapist. It's not because we don't believe that young person. It's not because we don't hear them when they say that they're transgender. We just find that at this point, given the amount of things that are evolving and changing in adolescence, having another supportive adult in the picture as part of the conversation can help the process go better.
This is an example of one of my clients who is under 18 looking to access hormone treatment. So it reads like this. Individuals experiencing gender dysphoria benefit greatly from receiving hormone replacement therapy to align directly with their experienced gender. Without this treatment, youth are more likely to experience clinically significant psychological distress, interpersonal conflict, and social isolation. Also, comorbidity with clinically significant anxiety, depression, and suicidality and substance use is higher among youth who do not receive medical treatment for their gender dysphoria.
I want to point out that this notion that people need letters or approval to get the care that they need is outdated. Our job in healthcare is to listen to our patients, to believe that they are experts in their own experience, and to support them in their journey towards health. So the idea that someone needs to prove that they're transgender or check boxes to convince me of their identity is something that is outdated and has really fallen out of favor. In general, we use an informed consent model. My job is to hear a patient describe their experience, what their goals are, walk them through the process, make sure they understand what the benefits, the risks, the timeline might look like, really give space to ask questions. With that information, they make an informed decision. We do this in all of healthcare all the time, and gender-affirming medications are no different.
My name's Cassidy Alfaro. I'm a transgender woman. My pronouns are she and her. My reactions from my family was they weren't really happy with my decision to be transgender, and they put me into foster care. Reflecting on that, I got over it, so my self-esteem is high, but it used to not be because of that. I would say me being able to vent about my issues and not feel like somebody's judging me about it and actually listening to me and giving me the best advice they can give. I got to further my transition and be more comfortable in my body after starting hormones.
There are many trans people I know did not make it to this day, and they died due to suicide.
Ernest, by the way. I'm 24, community advocate. I'm a program director over at New Wave Brotherhood, also a peer leader here at Ruth Ellis. My family always viewed me to be masculine, so nobody ever really kind of put me in a box or had a reaction. They was kind of like, oh, okay, cool, you doing you. It made me realize how much privilege I had, you know, compared to my fellow brothers. You know, everybody don't have the support of their family. So for my family to be so accepting to who I am, it make me be way more outspoken about who I am. You know, it's probably why my confidence is as high as it is, because my family allow me to be whoever I want to be.
It's a social justice issue. A lot of LGBT plus people have fought and even died for the rights to have care like everybody else. I found out that healthcare is one of those areas where racism and sexism and transphobia have yet to be dismantled. And so access to quality care that's safe and affordable is often denied to marginalized communities, including transgender, non-binary, and gender non-conforming people, because of the denial of healthcare by healthcare providers or untrained providers, for example, or being refused services, but also refusing services, not knowing whether they could trust that provider to treat them in a humane manner.
I mean, no one's gonna be able to like ever fully live your experience, but at least be empathetic and be understanding. If you don't have access to that, how isolated, how alone, how lost you could feel. These are really life-saving services.
I feel the most safe and secure accessing like healthcare that takes into account my gender may not align with my sex.
Gender-affirming care is supported by the major medical associations in this country and globally. That includes the American Academy of Pediatrics, the major bodies for family medicine, obstetrics and gynecology, internal medicine, the World Professional Association for Transgender Health, endocrinology, the list goes on. This is care that is viewed as medically necessary and is understood to have a huge impact on the well-being of patients and communities.
Gender-affirming care is not about gatekeeping. It's really about what my colleague has said. It's about supporting the person with their life, really, about sustaining their life, preserving their life, being happy, being authentic in the world, and being able to live out their lives like everyone else.
Providing this care can have a direct impact on someone's risk for depression, anxiety, and suicide. Gender-affirming care can be life-saving. And for that reason, it is endorsed by the major medical societies, both in the United States and globally.
All right. So any initial thoughts, questions, or comments? Oh, go ahead, Allison, I see you.
We had some questions in the chat during the video. So a lot of folks wanted to know what the doctors' names were. So if you can tell us like what they're, like the pediatrician and then like her name, and there's a lot of that.
Yeah, so the video is actually available for free on Vimeo. I can put the link in the chat in a little bit, gotta look it up. But Dr. Maureen Connolly, she works with Henry Ford Health System. So I'll put that, also known as Dr. Mo. Oh, I don't know if I spelled that right. Dr. AMORIE Robinson, also known as Dr. Kofi, is a clinical psychologist. And I think those are the only two doctors in the film, but yeah, I can share the link with folks.
Okay, yep. So then we had some folks chiming in that they've met Dr. Robinson and just saying how great she is. And then we had folks asking if they could get the video. So you just said that it's available, so you'll put that in the chat. And then I also let folks know that this is going to be on our YouTube channel, as well as you showed that video in one of the other trainings. So if they can't wait the 2 weeks or they can't find it on Vimeo, there is another option.
Perfect.
And then we did have one person respond to you asking initial thoughts, and they said the video was very informative.
Perfect. Yeah, we're gonna go into breakout groups and discuss the questions I'm about to put in the chat. But if folks have anything else they want to add or talk about before we get into that breakout group, feel free to do so now. You can add it to the chat or come off of mute.
I almost just read all your questions.
You can, if anyone needs to hear them audibly, feel free, but they are in the chat.
Okay, so what you'll be discussing in the breakout rooms is what got your attention the most, what's one thing you learned that can help transgender or questioning youth, what did all these youth have in common in their experiences, how is this information helpful to you as providers, and what implications does this information have for your work? And I will set up the breakout rooms. And again, we will not be recording during the breakout rooms.
So folks have any questions about what a breakout room is, how we can get there, get out. I'm sure a lot of people are familiar at this point, but just want to make sure. Okay, perfect. So we'll take maybe 10 minutes in the breakout group. Is that okay, Allison?
Yeah.
Okay. And then the link to the video is in the chat. Hopefully that works. All right. Oh, someone said they don't know what a breakout room is. Good questions. Okay, so in a second, you'll see a prompt come up on the screen. It'll ask you to join a room. If you don't see the prompt, if you're maybe not on a laptop or you're on a phone, it might not work. So feel free to stay in this room with us if it's not working. But you'll see, so I see a couple people in the car, please be safe. Or if you're on your phone, you might not see the option. So don't worry about it if you don't see the prompt, but if you do, you just hit that button. It'll take you into a separate room with 4 or 5 folks. And then when the 10 minutes are up, you'll automatically be brought back to this room. Or you have the option to exit out once you're in the room as well. Okay, thank you all for joining, folks who have to leave for another meeting. Yeah, Alice and I will be here in the main room. If you have questions and can't get in there, we'll help. All right, and Allison, I will set a timer once that is ready.
I'm working on it, guys. Sorry, I said to do it automatically and then it didn't. So just bear with me. There are a lot of folks here today, which is awesome.
And again, those questions are in the chat, so you can see them there. Okay, Allison, I see people disappearing, so I'm assuming you're getting them into the breakout rooms. I'm sorry you have to do this manually, Allison. I didn't even know that was an option. I've never even.
No, I said, I don't know what happened. I picked automatic. So
sorry, folks. You'll be in a breakout group shortly.
They'll have a lot of time to think of really good answers to share. So folks that are left, on my end, it looks like everyone was assigned to a room. So if you haven't, if you could chat me, otherwise maybe you're choosing not to participate, which is totally fine as well.
If you want, for the sake of time. I think there's only like 1 minute left.
Looks like everyone's back.
All right, perfect. So I know you just took a lot of time talking to other folks about these questions, but if anyone wants to share anything that came up in the smaller breakout groups with the larger group, feel free to here. You can use the chat or come off of mute if there's anything you think that would be meaningful to share with everybody related to any of those questions. I'm going to pull them back up.
Thank you. Happy Valentine's Day to you.
I feel like that was just for me. Thank you. All right. So again, we don't have to spend too much time with these. I know you just talked about them, but I'm just going to give it one more second if folks have to want to share anything. Okay. So one of the main takeaways is that you don't have to be a medical professional or an endocrinologist to do this work, to be more affirming when working with folks who have diverse gender. Anyone can do this work. It's really about respect, understanding how implicit bias works, and that it's not if, but when we are the folks who might be causing some sort of harm in the lives of others that we're working with, who might have, different identities from us. And so this is really about safety, accessibility, and making sure that we are creating safer environments, reducing suicidality for folks, reducing depression and other safety outcomes that we see showing up more with folks who identify as transgender, or non-binary. Okay. Things that you've had in common or folks had in common. I think the main thing is that their lives improved after receiving gender-affirming care. They experience less dysphoria. And often you heard in the video, people said, my dysphoria is actually caused, not like inherently, it is caused by experiences with other people. It is caused by when I have to go out into the world and people misgender me. So this improved people's lives. And that was an overwhelming theme and something that we hear a lot when we're working with people who are coming to the Health and Wellness Center, who are receiving psychological support. So it's not always about the support medically, and we'll talk about that shortly, different types of transitioning we're talking about. Yeah, I don't think we have to spend too much time here, but that is the main takeaway. You don't have to be a professional or a provider who specializes in LGBTQ affirming care. I always appreciate when people are like, I don't get it, so I don't want to do it because I don't want to mess up. We're all going to mess up when we're practicing new things. And sometimes it's just about practicing, asking questions, getting more knowledge and information. So, all right, we're going to quickly talk about different types of transitioning. We just talked about more so medical transitioning. So other than medical, we're going to briefly, for the sake of time, we won't spend too much time here, but just want to highlight that medical transitioning, maybe what we think of as medical when it comes to surgeries or hormone therapy, is not the only form of transitioning. Folks can transition socially. So these are some of the words that we might think of, or, that come up when we're talking about social transitioning. One of the big things here is coming out to friends, or just coming out to people and sharing who you are. That is a form of social transitioning. Externally letting people know, whether that is through clothing, hair, different types of non-medical things like wearing a bra or not wearing a bra, shaving, not shaving, sharing your pronouns with people. That is all social transitioning. So names and pronouns. If you are someone who uses pronouns that maybe folks wouldn't expect you to use, or your pronouns that your caregivers use with you growing up are different now. That is a form of social transitioning. So when we talk about pronouns, here's a Webster's definition here, but we are talking about what words we use when we're not using someone's name. When we're referring to a person, we don't want to keep using their name. How are we referring to them? And so these are some of the ones that we see most often. She, her, hers, he, him, his, and they, them, theirs is used a lot as a gender neutral pronoun. This does not work for everybody, but we often recommend that if you don't know someone's pronouns and you don't have access to asking them their pronouns, using a gender neutral pronoun like they can be a way to protect folks and create more safety for them. Some folks don't like they, them, theirs pronouns. So once you know, you can use the appropriate ones that person asks you to use. But in most dictionaries now, they, them, theirs pronouns are listed as singular pronouns. So not just referring to two people. Those pronouns can be used to refer to one person only. Do folks have any questions about pronouns before we keep on moving?
I am not seeing any in the chat.
Okay, we'll talk about it a little bit more. Okay. This is a study from the Journal of Adolescent Health that is showing using someone's chosen name and pronouns as they direct us to do so is linked to decreased suicidality and depression. So I know we see this in social media. There's somewhere to put your pronouns. There's, pronouns on email signatures more and more now. Anywhere your name shows up, we're seeing more options to add your pronouns. And so we're not doing it because it is politically correct. It is about being an ally for folks who are not trans or non-binary. It is about making sure that we are all talking about and to one another with respect, but it is also about safety. It is also about health and safety for folks. And so this is a huge why for us when we're thinking about those higher rates of suicidality and depression that folks experience who are LGBTQ, but who are trans specifically. This is a huge why for us. These are some immediate and simple steps to increasing safety. Basically, anywhere your name appears in writing, you can add your pronouns if you feel safe doing so. You can ask people to share theirs in different spaces and meetings, et cetera. But again, everyone will not want to share their pronouns. It is not always safe for folks to share pronouns. And so giving people the option is our recommendation. If you would like to share your pronouns with us, please do. Some folks will want to, some folks will not want to. But anywhere it appears, your name appears in writing is a way for you to share pronouns as well. And if you are someone who is doing that direct care work with people, it can be a signal to folks that you understand this, you are a safe person to disclose to share with. And so it is also about that. Okay. So we're talking about name and pronouns as a way of socially transitioning. Also, if we think about appearance and gender expression being, again, the gender roles we play within our culture, our home, our workplace, our physical appearance, hair, clothing, makeup, or lack thereof. These are all forms of social transitioning that don't necessarily have to be done medically. So as you can see here, there's a young person wearing a dress. This person was assigned male at birth, but is wearing a dress and a colorful wig. And so when we're thinking about young people who have diverse gender expression, who don't have the language or maybe the identity to say, hey, I'm trans, this is a big deal thinking about gender expression. And for a lot of young folks, they are not allowed to do that in the home, that it's not something that is supported. So when young people are allowed to be themselves and allowed to not hide themselves, that can be really beneficial. This is not the same as young people who are exploring gender roles, who are playing with different toys and just kind of understanding who they are. This is something that is insistent, consistent, and persistent for 6 months or more. And that will show up in different ways for different people. But there is an insistence, a consistence, and a persistence for 6 months or more with young people when we're thinking about their identity and identity formation and having diverse gender identity and expression. This picture on the right is from a PBS map that I can share in the chat. They highlight in this map different cultures around the world that have always practiced or incorporated diverse soji into their culture. They've had language to talk about diverse soji. So this is the Mahu, who are in Hawaii. And if you look at that map, you can click on different places on the map and learn more about, in a pre-colonial context, so before folks experienced European and Western beliefs, what were they doing and practicing? So that is an example of folks who always incorporated, not incorporated, but always had space for people who had diverse gender identity and expression. So these people were not only integrated into society, they were thought of as being special, having special attributes that could contribute to the society because they had diverse gender identity and expression. So they were thought to be people who could carry on the tradition orally. They, were teachers. Similar with Two-Spirit folks who are Indigenous or Native American, their culture have often, really affirmed those folks, in a pre-colonial context. Those folks were thought of as being special and having special access to the spirit realm, all of those types of things. So these were folks who were revered in a lot of different cultures prior to Western colonization. Okay, so some other non-medical ways that people can transition. A lot of folks will do voice and speech therapy, so their voice closer aligns to who they know themselves to be internally, either body hair removal or transplants, thinking about clothing and shoes again, makeup, permanent makeup, tattoos, psychological support, seeing a therapist, talking to someone about this can be really helpful for folks, as well as spiritual or religious affirmation for some folks. I'm just going to skip ahead really quickly. This is a video that I can share the link in the chat that is thinking about spirituality along with gender affirming care. And so this doctor is a Two-Spirit doctor who works with Two-Spirit youth in Canada. And they mention spirituality a few times in the video and highlight why that is so important to connect that history to someone's trans identity, thinking about history and spirituality in that culture. So those are all ways that people can feel more affirmed and be more affirmed. Any questions? Okay, I know we're short on time. Go ahead, Allison.
Oh, nope, I don't see any.
Cool. Really quickly, these are some feminizing, non-medical ways that people can affirm their body. There are different stores that sell these products. There are shape enhancers and gaffs. So the appearance of larger hips or a bigger butt, those are more feminizing. Folks can buy those products at different stores. There are different devices that help folks who maybe were assigned male at birth. Tucking, things like that would be in the form of a gaff. Breast forms and prosthetics, those can range from, things that are knitted to like a more expensive version like you see on the bottom or on the left. So sometimes these can be pretty costly, especially if you want them to match your skin tone and fit a certain way. It can be more costly. And so I know our medical staff kind of budget some of these things in. They might seem superficial to folks, but they are really, really affirming and can be very helpful and life-saving for folks to feel most themselves and for their exterior to match who they know themselves to be internally. So these are packers, STP, stand to pee. They can help folks, use the restroom and feel like they don't have to go into a stall. Binders and tape can help decrease the appearance of having breasts. And so those are all non-medical ways that people can feel most themselves, feel less dysphoria when they're out in the world, if that is something that they want to do. Any questions about non-medical gender affirming services or care? No. Okay. So we're not going to spend much time here. We learned about this a lot in the video, but medical transitioning, which you heard Dr. Mo talk about as being not only really, really supportive and helpful, but also medically necessary for a lot of folks. And we're not talking about surgical stuff in this training. This is mainly talking about puberty blockers and hormones. So as you heard in the video, when a young person is approaching puberty, this can be a really stressful time for folks. Anyone, puberty is stressful, but for folks who identify as trans, non-binary, who fall under that umbrella term, this can be especially a really dysphoric time for folks when their body is changing and doing things that is not in alignment with who they are. And so puberty blockers give folks time to pause puberty. It's typically done for a year or so, maybe a little bit more at the onset of puberty or before. As you heard, caregiver consent is necessary for youth and adolescents, caregiver support and a signature, as well as a therapist, a mental health practitioner signing off and talking about the necessity of it. So again, this gives folks time to pause and breathe. Some young people will continue on with hormone therapy, some will not, but it does give them time to understand their body and what's happening more. All right, so once, and again, puberty blockers, puberty starts after you stop taking puberty blockers. And, so puberty will continue on if that is what that young person wants to do. That will continue on once they stop their puberty, or if they decide to take hormone therapy further, they would start either testosterone, estrogen, or progesterone, and continue on with the puberty of the gender identity that aligns with who they know themselves to be. And so people will do hormone therapy in different ways. It looks different for everybody with the type of hormone they are using, whether it is injection or a patch or a cream, whether it is something administered really regularly or not as regularly. So we're not talking as much about that today for the sake of time, but those are the two main things we're thinking about with hormone blockers for younger folks, and then hormone therapy for folks as they get older and understand if they would like to continue on with this or not. Any questions about either of those slides with puberty blockers or hormone therapy?
No.
Okay. And so, yes, with hormone therapy and blockers, folks will have to meet with a therapist beforehand, make sure that this is in alignment with what they really need and want, and go from there. And these things have been used for other conditions and other things. So there's a lot of safety data, not necessarily for working with trans folks, but people have used these things for other conditions for years. And so we know that they are safe to use.
So kind of what you just said, but someone did ask in the chat, says, I'm curious if there is any data on the discontinuation of puberty blockers due to discovering agreement between gender identity and biological sex.
No, let's see here. No, let's see. We heard with Dr. Mo. Let me see. I'm just continuing due to discovering agreement. No, so no discontinuation. Most doctors think that it is medically necessary for the folks who need it. Good questions. And we don't talk about it in this video, but folks who identify as intersex are often given different hormones and hormone therapies for a completely different reason, but that is a way of thinking about how young people have used hormones and hormone therapy for different conditions. Okay, and then finally, legal transitioning. This is thinking about the ways in which we have to move through the world with legal documents and how having access to affordable documents that mirror who we are can be life-saving for folks as well. So this can decrease discrimination and violence. It can increase access to things like job opportunities, housing. So if we're thinking about housing specifically, I know that's the work that you all do, this can really increase social access for folks. And when their IDs and documentations are not in alignment with who they are, and some things are switched and some things aren't, that can create a lot of confusion as well as a lack of safety for folks. So it can be, this can be a stressful process for people. So depending on the state that you're in, this changes and varies with what step you should do first, whether it is a hassle or not. Most of it is a bit of a hassle. And for folks who don't have a lot of access or income, this can be pretty costly. So I know at the Ruth Ellis Center, we have a name change clinic where people from Fair, Michigan will come and support folks for free or reduce costs, helping them with name change efforts, gender marker changes on different documentation, et cetera. But it can be a lengthy process that does include having to go to court, having to, you know, post in a newspaper, pay a lot of money sometimes. And so it can be time consuming and costly.
So there's a comment in the chat that just says legal transition is so important and can be very euphoric.
Yes, so we know that when people's documentation, and I don't know what you meant by euphoric, but like, feel free to add if you have anything else to share, but I know that this can be a super affirming for folks when they get it, when they don't have to worry about driving and being pulled over and their ID not matching their gender identity and expression. It just relieves a lot of that tension and stress for folks when they have access to this.
And then someone else added about $400 to $500 depending on the county in Michigan.
Okay.
I have a question. Does anyone who changes their name has to put it in the newspaper, or is this
in Michigan? It's different from state to state, but in Michigan, yeah, anyone who, okay. Yeah. So if you're thinking about, oh, I'm getting married, got to change, you know, I don't know, things like that. Yeah. Anyone changing their name. Yeah.
Just seeing if it was just some weird thing for this population.
Yeah.
And then this is someone's asking, can this be done for a youth by a parent?
Ooh, good question. Yes, with caregiver consent and support from a caregiver, yes, that can be done.
And we posted, yep, we posted in the website a link to, it is not this specific about changing your name due to gender identity, but we do have some information on Micah's website about getting free Michigan documents if you're homeless. So we posted those in the chat.
Thank you. This is just a quote thinking about how intrusive and burdensome it can be for folks. Some states requiring surgery for certain documents, requiring folks to show proof of surgery, which requires a whole nother set of steps that people have to go through. And so this is just thinking about how difficult that can be for folks and intrusive with information needed. Okay. I think for the sake of time, we're going to go ahead and just wrap it up, see if folks have any questions. Yeah, it is 1:30. Well, I'm in Chicago, sorry, 1:30 my time, 2:30 your time. And yeah, any questions or comments?
So we just had a comment come in that says this was very informative and educational. So I will start, I'll start doing our plugs, but feel free to add in any questions for Angelica while I'm talking, and I will make sure that we ask those as well. So don't be afraid. Still, if there's time, if something comes up, please ask your questions about this gender affirming care for a second. But I just, so we have the person who made that comment earlier says euphoric, meaning my ID shows gender X rather than female, male, or the FM. And my assigned sex at birth is not displayed. Someone's asking if there's slides for this presentation available. We did not get those today as this is a free training, so we do not have those slides. We have more comments coming in for great information. Thank you. So keep those coming in. Oh, I see you have the Ruth Ellis stuff, so why don't you go into that first and then we'll switch.
Well, I just brought these up while you were talking. It's basically just like, these are some of our programs and the, you know, the scope of it, the ages that we're thinking about when we do this work. So if folks have any other questions, feel free to reach out to us. This is our permanent supportive housing building that is currently in the works. It's gonna be 43 units. Referrals are coming through the CAM. And these are just different resources for youth ages 13 to 30, drop-in center. We have a space specific to young women and girls who identify as queer. There's a long story as to why there's two separate spaces, but everybody's welcome in our drop-in center, but sexism has been operating in this community like in all. And so anyone who identifies as a queer woman or girl There's another space that folks can hang out in, and family preservation, ages 5 to 21, and their caregivers are welcome to take part in those services with behavioral health folks. And then this is information about our health and wellness center. We serve folks ages birth to 30, and we work really closely with Henry Ford staff, who you saw in the video. Dr. Mo is one of them. So that is it. I'm just gonna pull up, our contact info. Feel free to contact us if you folks have any questions. Okay, go right on ahead, Allison. I'm done.
Yep. So we're gonna share our screen for a second. I want to thank Angelica for sharing her time and her expertise today, and for the great partnership that Ruth Ellis has shown to Micah and all of our service providers for the last year. We really appreciate that. We want to let you know that we have another training coming up next week, which is the Mindful Leadership in a Pandemic. It is $50. It's $40 if you are a Micah member. I'm super excited about this one. So you can see the link there to register, or you can find more information on our website, which is mihomeless.org, for more specific information, including the speaker's bio. She is going to be coming, since it's virtual, all the way from Pennsylvania. And then we also want to let you know that the way that we are able to offer the Micah Academy, which is this free training, is through membership. So we would love it if you thought about being a member. It's $45 to be an individual member, or if you'd like to be an organizational member, that is available to you as well. You cannot click on these links. I'll try to add them to the chat when I have a second, but that's how we pay for this. So we would love your support. If you've attended one or many, we'd be really grateful for you to join. The free training in March is going to be on assertive engagement and will be presented by CSH. And then we have another training this week, which is the first in the series on trauma-informed care. It's trauma-informed care and cultural humility. And you can find the information for that on our website as well. We cannot email anything out because we don't have the capacity to do so. So the links are all on our YouTube page. The ones that Angelica put in the chat, I would just suggest that you link to those while you're in here. I'm sorry that it's not a little bit more user-friendly. We're getting a lot of comments coming in, thanking everyone for the work that they're doing, thanking you for this training. So I want to also make sure that everyone knows that we appreciate your time. I know that the work that you do is hard and never ending, but we really appreciate you carving the time out so you can serve your clients better. We will end the webinar now, but I'll leave this open for a few minutes so folks can grab all those links, because I know it was some really good information. But with that, I hope you all have a wonderful afternoon, and we hope to see you at our next training. Bye.